So in Bangladesh, we have been doing most of the projects in response to the cyclones over there, and post cyclones we have been helping out there. So we right back in 2007 we responded to the cyclone Aila, and then there was cyclone Sidr and all those cyclones, and we went there. We responded, provided medical help, food, shelter, and other things, clothing in a big vast area in Rangabali, and then once the emergency phase was over, we worked with the deputy commissioner of that area and provided permanent shelters. So we went into in Rangabali district. There was an island called Char Anda. On that island, we went there and built homes which were cyclone proof for all the families on the island. So this was the major work that we did. In addition to that, we have supported refugees. We have responded to other programs. More recently, we are helping the Rohingyan refugees over there. We were looking after two main camps and other smaller camps, providing food to 1,000 people on a daily basis. We had 3 doctors deployed for many months who were seeing patients, 400 to 500 patients. We were providing hygiene stuff like temporary washrooms, soap and other things. We were cleaning the area by caustic soda so that the infection is not prevalent. In addition to that, we have been providing clean water, installing hand pumps in those camps so that people can get clean water. And that work is still continuing over there. And now we have recently started a very major project to take care of mother and child in Bangladesh.
Mm-hmm. So since when you started the project in Bangladesh?
We have been working there at least from 2007 onwards.
Okay, so almost 10 years.
10 years now, yes.
So in during these 10 years, you have raised like how many $1,000 and how many $1,000 you provided there for all your projects so far?
I don't have the numbers offhand, but I know that at least 300,000-400,000 were given there just to provide to the response to the cyclones over there,
mm-hmm.
and that was many years ago. And then we have been doing some smaller projects,
mm-hmm.
But I don't have the exact numbers at this time.
That's fine. We can add it later on. So, how you organize your projects in Bangladesh, because you're living in Canada, and how you work from here there, and how you get the result and benefits?
So, one thing is that I have lived in Bangladesh. I was in Bangladesh before, and I have got a deep love for that country where I spent my small bit of childhood over there. I used to go to school in Dhaka. I've lived into other places like Barisal, Chittagong, and Mirpur, Mohammadpur, and there was another small town called Bhedamara.
Mm-hmm.
And so I used to be there, and so a natural affection is there with me. Plus, we have the Ahmadiyya Muslim community over there,
mm-hmm.
who is actually our resources on the ground, mm-hmm. and Humanity First Bangladesh is also active over there. So we use these resources over there, but when there's a large project, then we send a team from here.
Mm-hmm.
The, Humanity First is now registered in 50 countries around the world. And what we have done is that we try to empower local people, mm-hmm. so that they do the projects over there, and we have only oversight based to satisfy the government regulations. Mm-hmm. So we will send money to Bangladesh. We will have our agents or representatives over there who are going to do the actual work for us. And this is all volunteer based, so there is no administrative cost, no salaries to be paid. Mm-hmm. And then we will visit there to see everything is done according to our expectation, according to the government regulations and all that. So we also make partnership on the ground. So when I went to the Barisal district to help out on the cyclone affected people, I met with the DC over there and established a relationship, who really offered me all the support, introduced me to the local contractors and people and all that. And we worked just over the phone, we worked with them and got our project done over there. Right now, the new project that we started, so we have contacted some university professors, medical doctors, mm-hmm. who are professors, and other gynecologists and obstetricians to have an oversight of the program, and we have started this program in 2 districts in there.
So, we are going to install a booth in our Bangladesh festival, which is going to happen this end of this April, 28th and 29th of this instant. And so mainly last year, what we did, we promote Humanity First over there, and we distribute flyers, we distribute water and chips to the children, and people also contribute, and they had a know-how about Humanity First. That is the motivation to do it again this year. We're going to go there with new projects.
Yes.
So to raise the fund for this global health program, so how the audience or the visitors in the stalls can help us to raise funds, and what are the means to contribute?
Yeah. So I would like to start with the introduction of this program. This is a very important and a dear program to us because the mother and child care is the basic help that you can provide to any community to be sustained. If the mothers are healthy, they will have healthy babies. If they're healthy babies, then the nation will be healthy, and they will be able to come out of poverty if they don't have to spend money on the health care. So global health is one of the core programs that we are doing around the world. In Bangladesh, we are now starting this special project in partnership with the local doctors over there. The project is called Bangladesh Mother and Child Health Centers. Mm-hmm. So currently we have acquired 2 centers in partnership with another group, where we have a couple of doctors, midwives, nurses, and other staff who are going to take care of pregnant women. Mm-hmm. Then they will provide them and guide them through the birth process. Mm-hmm. And after the birth, they are going to take care of the health care of the mother and child. Mm-hmm. So this includes not just treating illness, mm-hmm. but preparing them to prevent illness, mm-hmm. to prevent complications. Mm-hmm. So when a woman is pregnant, we tell them what care they should take, what should they avoid, and all that. Then we provide them how safe birthing can take place. Mm-hmm. We provide them supplies and support over there, mm-hmm. and also help them with the birthing if they need to get admitted to the hospital or clinic, do that. And once the child is born, then we ask them to come regularly visit the center, mm-hmm. where we measure the birth weight and the health of the child, health of the mother, and give them vitamins, vaccinations, and all those things to continue. In addition to that, the education part continues. For example, the antenatal care before the pregnancy, then postnatal care after the pregnancy. We have a lot of education sessions, which is a very different way of.
So what you are educating there actually?
What is that?
What you educate?
Yeah. So we tell them about safe home deliveries, what the mother should eat during the pregnancy, what they cannot give to the child, how they have to take care of the child, how they can prevent injuries to the baby, mm-hmm. and also the child care. The child gets sick, mm-hmm. they will provide them treatment. The doctors are there, nurses are there. So we are serving about population of about 100,000 people people in Chandina and Komila, and also in Brahmaberia, in Vijayanagar. Yeah. So we are providing them. These 2 clinics are being run over there, and on a regular basis we are seeing a large number of patients who are benefiting from this and providing support to them. But this project is expensive project because we are sitting here, mm-hmm. and you have a facility over there, you have doctors, nurses, and other staff there. You have to pay their salaries, mm-hmm. and supplies, medicine. We give free things to the people over there, mm-hmm. and that large population mm-hmm. Is quite satisfied with this. The government is also happy with this. Mm-hmm. This is all a government approved project. Yeah. Now, the cost to run this project, just to run this project, not the building and other cost and everything, mm-hmm. is about $25,000 per year. Mm-hmm. Now, from Canadian perspective, it's a small amount, mm-hmm. but we need support, and we are doing projects in 50 countries, mm-hmm. and for that I need funds for sponsoring all those projects. Mm-hmm. My hope is that this Bangladesh festival that is happening, they should take the ownership of this project, mm-hmm. and the Bangladeshi community mm-hmm. should say that we are going to support this project. $25,000 is not a big money for Canadians.
Right.
Just imagine if somebody starts giving $2,000 a month.
But this is a recurring expenditure.
This is a recurring. It's not one time.
Yeah.
This is a long-term project. We need every year $25,000. So if there's a business who commits $2,000 a month or give one time $25,000, we will take care of the whole project and we can dedicate to them. And they will say that a population of 100,000 is benefiting from them. Over 150, 200 patients are getting service on a regular basis from this hospital. So it's a good opportunity for an act of kindness, for some charity, that there is an established project which is proven track and record, a very, very reliable organization, that there is no administrative cost. We are all volunteers and the work is already being done. So there should not be anyone who should hesitate to support it. So I don't know what the attendance of this festival will be, but if there is only 1,000 people there, if each one of them gives $25, you can cover the cost.
Yeah.
It's as cheap as that. And covering the cost means you are saving lives.
Yeah, of course. That is the main thing. So those properties, Humanity First
No,
own
we
those?
don't own it.
Okay.
This is owned by our partner organization. It's called Bamina.
Okay.
They are and they are also non-profit charitable. They are professors of university and specialists over there. So they are not making any profit from this.
Okay, so who are those famous names actually? Any?
The most famous name is Dr. Sadka Tahira. He's a professor in Bangladesh Medical University, and she is also overseeing my project on our behalf. So she's the...
So we people from Canada, when we're going to contribute it, some people may want to know if the name will be, they will know the names from it, that person is giving money or something. So there are some people.
And that is fine. We can pray for those names and we can definitely send those names over there. But this is a large project where unless there's a big donor, we can probably put their picture and number there. For small donations, we don't have any system over there.
I know.
Yeah.
So what is the, like, if somebody wants to pay 1,000 or more, you can advertise the name or something?
Yeah, we can advertise the name.
So is there any standard donation amount or something like that?
So we are looking for our main sponsor is somebody who can really give $25,000 annually. So this will be covered. This will be a good project and we will dedicate that project to them. We will have a sign and we're going to provide them all the pictures and everything with their sign. So they will be our main gold sponsor for this.
So is there any video documentary so we can play there and people can see and these things?
I don't have that.
Or any pictures?
Pictures, yes, we have pictures.
And if you can ask videos from there, they can send.
I can ask for
through.
videos.
We can play there.
Yes,
I will. That will be more impressive and attract our audience.
Definitely, I'll ask for the videos, but I have pictures. I can.
And also, if the main person you mentioned, that famous doctor, if she says something. And we can also play there.
Absolutely.
Some of the doctors were there, and some showing some passion, they're treating those kind of documentaries. So
absolutely,
it will be more helpful.
That would be wonderful. I will try to get those and pictures. I can send it to you. Not a problem. The other option is that if we can find two donors, because there are two clinics we are running.
Yeah.
So each one, if they give $12,500, we can say that one person is sponsoring one clinic, the other person is, and $12,500 for large business is not big amount.
Right.
They can give that. Even somebody promises to give $1,000 per month.
Yeah.
That's $12,000 right there and then.
Yeah. Yeah, she can. He or she can split the amount throughout the year and pay on installment basis.
Yes.
Okay, so anything we miss?
No, I think we need a support. This is only one of the projects that we are doing in Bangladesh. If people come forward, we can help in other projects like providing clean water. We can drill hand pumps over there. We can take care of orphans over there. People can partner with us. People can volunteer with us. They can donate to us. And we can have other projects like surgical missions over there. We can send specialists from here who will go there, perform surgeries and come back. So, but we need support. I mean, this is all possible if we have enough funds to do that.
Yeah.
And I would like the Bangladeshi community to become our sponsor and partner for all our Bangladesh projects.
And what are the way to contribute, like online or
it's very easy.
or
Yeah.
a stall and both?
Yeah, anybody can go to humanityfirst.ca. They can use their phone or website or computer and just donate over there. Go to the donate page, click, and it can be done in 1 or 2 minutes. The whole donation can be processed.
And if they have any question, they can call you.
They can call us, or they can call us. They can ask question, and they can donate on the phone also.
Okay.
We are open here 7 days.
Yeah.
We will take the call. We'll take the credit card number, and we'll process the donation. The third way is that they can mail the check to us. They can find our address at humanityfirst.ca. The address is given on the flyers also, and they can mail the check to us. The fourth option is that if nothing is possible, they call us, and we'll send someone to get the money in.
Or instead of your project, if they come up with their own project and want your support, what do you do?
So there are certain criteria that we adopt projects. First of criteria is that it has to fall within the one of the 9 projects that we do.
Okay.
Either
Tell our viewer
Yeah.
what are the projects.
So the 9 projects that we do is global health is our core program, which is medical and surgical missions. The other programs are knowledge for life, where we build schools to provide help to the students. The third one is orphan care program, where we take care of children and provide them full support in the foster family model. The fourth program is learn a skill, where we provide education to the adults, vocational training programs. Then fifth program is refugee resettlement. We have been helping refugees to resettle in Canada. We provide them support there. We also provide support to refugees in the camp, like we have been helping Rohingyan refugees. In addition to that, we also have Water for Life program, where we go out and drill water wells and provide clean water to those people. And the community care program that takes care of local community needs, like shelter or something like that. And our one major program is food security, where we establish food bank and provide food to people in need. This is a Canadian program that we do here in Canada.
So, dear viewers, whatever the root causes for the problem in the people's personal life, but our objective is to help them. It doesn't matter whatever the causes for their problems. So you understand that through Humanity First, in a coordinated effort, we will help them, and we'll help to build the new nations. We will take care of the children and mother. Also, we'll feed them the healthy foods or pure water, and also build new projects over there in the long run and short run as well. So thank you very, very much,
You're very welcome. It's my honor.
Aslam Daud, and of course you're welcome to our booth. And
Inshallah,
come and
I will
see
drop
me.
by actually. Inshallah, this year.
And we will talk again over there.
Okay.
Thank you very much.
Assalamu alaikum.